I'm about to tell you how you can get relief from your headaches in 15 seconds or less. I'm Matthew Reardon. I'm a doctor of physical therapy here at Professional Physical Therapy and Training, located right here in the Madison area YMCA. So, in the last 6 months, we've seen such an increase in people who are suffering with headaches as well as TMJ or jaw pain. The reason for that is we're spending more time sitting on the computer, more time with just a general sense of stress, which a lot of people carry their stress in their shoulders, and also wearing masks. Wearing masks will pull your ears forward. They can change the musculature in your face. Breathing through a mask, you can change how you're positioning your face throughout the day. And so we're really seeing a big problem, a large increase in the amount of people who are suffering with this problem. So we've been treating headaches and TMJ pain for years, and my staff is excellent at it, and there's some really great, very effective, quick techniques that we could teach you to do at home. So what we would do here in the office is a cervical mobilization, we call it. Basically, this is the spine, this is the back of the head here, and then we have these yellow things. These are the spinal nerves, and then the red things here, these are the arteries, and these go up into the skull, and they really can affect, from here all the way up into the front of the head. So if you have a frontal headache, which is very common, this technique that I'm about to show you is very effective. So the back of the skull, now this person is now facing to the side. We have the back of the skull, we have the first vertebrae, and then we have the second vertebrae. This is the second vertebrae, but it's the first one that sticks out right below your hairline. So right back here, you'll feel a little bump, and that's what we're going to hope to relieve. So what I do in the clinic, I'll take sort of we call it a pincer grip, and we push forward. We support the head, and we just kind of glide or shear forward. We're not pushing very hard. This is not a quick manipulation or anything like that. We're just doing a very subtle sort of gliding, oscillating back and forth, back and forth. So it's very easy for you to do at home. Often when I do this for patients in the clinic, they're amazed. Their headache is instantly gone, if not significantly reduced. But the good news is I could teach you right now how to do this at home for yourself. So what we do is we cross our hands like this. We're going to put them over and just come right down below, right where your hairline ends. You'll feel that little bump right in the center, and I'm just going to push gently forward, oscillate on and off. I'm not trying to pull my head off my neck. I'll show you from the side. I'm just oscillating forward and back. I can do that by kind of rounding my shoulders and then relaxing. Round my shoulders and relax. I'll show you from the back. You can see my fingers are crossed. I can round my shoulders and relax. Round my shoulders and relax. And actually, in about, I think it was maybe like 7 or 8 repetitions of that, my head feels a little bit lighter. My neck muscles feel a little bit more relaxed. And if I had a headache, I would definitely say it would be gone or significantly reduced. That effect may last the entire day. It may last several hours. It might only last 30 minutes. And that, in a course of a stressful workday, if you could buy yourself 30 minutes without going to reach for the medication bottle, which in fact might take 10, 15, 20, 30 minutes to actually give you an effect, if at all, this technique can be relieving of your headache pain within 15 seconds. So, and you can do it repetitively throughout the day. There's no limit on how many times you can do this. And that will maybe get you to the end of your day where then you can rest properly, eat properly, stay hydrated, and do other things that would properly maybe get to other sources of your headache. So like I said, we've been seeing a lot more people with headache and TMJ pain, and that's why we decided to put out a list of tips report. We've decided to put out a tips report, which